So can you guys see the screen? Just a minute. Let me. Okay, so I can see the chat box. Just type in the chat box because I've shared my screen, so I won't be able to. So welcome everyone. This is a session especially for beginners who have just passed their Plab 1. And what I'll be discussing is the marking criteria basically, because you have to know that how you are marked, so you work on those things, right? So so the topic is the basics of the exam and the marking criteria. So you'll have a homework. So when you think that you are going to start the preparations, so you start with these two things. You go to the official website. There is a top tips from Plab examiners. Do read that very carefully. And there's another thing about how to avoid common mistakes. So these are available on the official website. So go and read them, right? So in this exam, uh, I hope you have seen the introductory video that I posted. So there are three domains. Okay, the first domain is data gathering. So you have 4 marks in it. Every domain has 4 marks. So what comes in data gathering? It's the history and the examination and the investigation that leads to the diagnosis. For example, it's a heart scenario or it's a chest pain scenario. So it would be the ECG. Okay. So this comes in the data gathering. The second domain is the management. Uh, Also 4 marks, and it includes how you explain the diagnosis or the condition to the patient and how you address the concerns. When you start your management, there would be a lot of concerns, and how you answer those things, that will count in your management. Yeah. So the third one is interpersonal skills, also 4 marks, and it's actually how you approach the station. Do you look professional or not? By that, it means that you have to keep a balance. You don't look so much friendly, you do not get so much chummy with the patient, but also you do not sound very harsh. You have to keep that professional dignity as well, but you have to sound a little bit friendly as well. So you have to keep that balance. Okay. And how you improve your interpersonal skills, there is open ended questions, closed ended questions. We'll talk about it later on. So that comes in your interpersonal skills. And the other thing is, are you sounding natural or not while communicating? It's very, very important that you do sound natural when you are in the cubicle. The examiner should get this vibe that this person is just acting natural. He would be like this if he is just in a normal in his normal clinic routine. Are you getting my point? So let me know if something is not clear. Just type it in the chat box, and I would be able to see it. Now we'll discuss the qualitative criteria as well. So yeah, so these are two types of feedbacks that you'll be given in your scorecard. Okay. Uh, so when you get your Plab 2 result, there will be these two criterias in which you will be marked. So the quantitative we discussed. Now this is the qualitative feedback. We'll discuss this one by one. Okay. So this is, you'll be marked on your consultation, issues, examination, the findings, diagnosis, management, rapport, listening, language, and time. Most of the people know about this thing that, okay, we have 3 domains, but they do not focus on these qualitative criteria. There are 10 criteria. Okay. They somehow fit in the quantitative feedback, but you have to know it individually, that what is expected from you. Okay. It's very important. First is the consultation. What it means is that, are you organized or not? Okay. By that, it means that, first of all, you'll take history, and then you'll do the examination, then you'll give provisional diagnosis. Okay. Then you'll explain the diagnosis, the relevant investigations, and the management. Okay. This is a way you should organize your station. For example, if we look into a general approach, it should be like this. For example, it is the history of presenting illness. Okay, if someone has come with a chest pain, so you elaborate the chest pain, all the Socrates, when did it start, how has it progressed, anything making it better or worse, is it radiating elsewhere, all those questions. And then the questions to rule out differentials. Okay, then the P2 maftosa, any medical conditions, allergies, family history, travel, occupation, social history, all the smoking, alcohol, recreational drugs, exercise, diet, that is all included in the social history, and who does the person live with. And then the ICE we do, okay, the ideas, concerns, and expectation. Then you ask effects on life. For example, if there is a chronic illness, how this is impacting on that person's life. Signpost and summarize is something that after you have taken all the history, you just ask the patient that, you have mentioned this, is there anything you want to add before we move forward. So this is a standard approach that you can apply in every station. Okay, there will be a little bit changings in few categories. For example, in peds there will be something different. In gynae obs, there are 4 P's that you add in this, but generally this is the approach. So you should be very organized in your consultation. It should not sound that you are going haphazard, like jumping from here to there, and that is the thing you'll be marked on. Okay, similarly doing an examination. So first you mentioned the observation. So okay, Mr. X, I'll be going to examine you, if that's okay. So I'll be checking your observations, and then I'll do a specific examination. Maybe it's an abdominal examination or whatever. So be organized. Does that make sense? Write in the chat box so I know that you are getting my point, so I move forward. So consultation is clear. Okay, thank you, Dr. Hira. So this is about consultation. Okay, so the second thing is the issues. Are you able to recognize the main problem? What is the core of the station? What are they expecting from you in that particular station? Okay, what is the key element of the station? If you are not able to recognize the key element and you are just going here and there, then you'll be marked on the issues. For example, there might be a scenario where for example, say Mr. X, he has got celiac disease. Okay, and he presented with some diarrhea and abdominal cramps, and now you are here and you have to counsel on endoscopy. So that's the key element. What is the key element of the station? You have to counsel on the endoscopy, what it involves, what are the things he has to be careful about. Okay, all those things. But it's a follow-up case, and if you waste your time talking about all the abdominal cramps and all the tiredness, and you are there ruling out 10 differentials out of it, so you'll miss the main issue. You will not even have enough time. Okay, another thing is that, for example, there's a scenario where someone is coming in, for example, a son comes and he demands to know about her mother who is admitted. Okay, and you don't have the consent to talk to the son about the mother. So the key issue here is that you have to keep the confidentiality. Okay, this is on your part. As a doctor, you have to recognize what is the main issue. Okay, the other aspect is that you ask for the concerns, what the issues the patient is having, what the main issue the patient is having, what's actually bothering the patient. So you have to know that as well. So these has two aspects. One, you have to know as a doctor. Another one, you have to find what the patient is concerned about, or what the patient is really being bothered by. So the third is the examination. Okay, so are you doing the examination properly? Do you make the patient comfortable? For example, if it's a testicular examination, you must offer a chaperone. Okay, doing the steps correctly, proper use of instruments. Some people even forget to mention it at all. Okay, so they'll be marked in the examination. So it's important that whenever you have a station, always mention that you are going to examine them. Okay, is that clear? Can you guys hear me? Just confirm me in the chat box, please, so I move forward. Okay, thank you. All right, so the fourth one is the finding. Okay, so you should be able to pick the findings both in the history and examination. Okay, uh, so for example, in history, how you do not miss a finding. For example, if it's an MI, you have to ask in history you have to find if the pain is radiating towards the left shoulder. Okay, the duration of pain, all the things which will lead to an MI, so you cannot miss the findings in your history. And same as in examination. For example, a person comes with urinary retention, okay, and on examination there's a distended bladder, and you should be able to find that distended bladder on percussion. Similarly, maybe there's a patient who has alcoholic liver, and on examination you should be able to appreciate the enlarged liver. Okay, so these are the findings that you have to find. You should be able to find both in your history and your examination. Does that make sense? Do the patient have okay, Dr. Bilal, in the mannequins, you get the findings. Okay, there will be enlarged liver, there will be distended abdomen. You can appreciate that. We most of the time the examinations are on a mannequin. Okay, there'll be a dummy and you have to examine on that. But you have to follow all the steps, practice them very well. Okay. Now the fifth one is the diagnosis. Okay, so it depends on case. Either it would be expected from you that you should give the provisional and the correct diagnosis. For example, there is a chest pain, okay, with classical symptoms, with all fever flu like symptoms, then you should be able to give the provisional diagnosis that it's a pericarditis, okay, or for example cholesteatoma, okay. These things like that, you need to say the words that I'm suspecting that you are having this and this, and to confirm we'll do further investigations. But there could be some stations which could be a little bit vague. For example, if there is any lump, okay, a person who comes with tiredness, there you can even mention some differentials as well. For example, if a person comes with tiredness, okay, and he's also having body aches, and you rule out everything, all the red flags, everything is negative. So the two differentials would be, it could be a chronic fatigue syndrome or fibromyalgia. Okay, so you just mention two or three differentials, but normally most of the time you should know the diagnosis. Okay, they do expect from you. All right, so the next is the management. Most of the people get marked in the management mainly because they are not able to manage the time. So they get marked both in management and time as well. But the management, it's actually how you are managing on a junior level. Okay, so there are, and it should be according to the best current practice. You can see the guidelines on NICE guidelines or NICE CK. Okay, so it should be according to best practice. There are 7 steps in management that people usually follow. The first is the admit, observe, or refer. So a patient comes to you, what you are going to do, either you're going to admit him, either you're going to observe him, or you're going to refer him, or you are going to just send him back home. Okay, that's the first step. The second one is involve senior. You are always working under the umbrella of the seniors. Okay, you are a very junior member of the team. The FY2 is a very junior doctor. So you always mention the seniors. Okay, always do involve them. Always get your patient reviewed by the senior. So the second step is involving the seniors. And after discussing with the seniors, you come up with the relevant investigations, the blood works, maybe you need to do a chest x-ray, maybe you need to do ECG, all the things. Okay, so the third one is the investigations. And then the fourth one is the symptomatic treatment. It's very important, circle this four. It comes in our domain. For example, I'll give an example. If a person comes, there's a scenario, and you are able to diagnose vestibular neuritis in the end. Okay, the patient it was feeling so nauseous and he was vomiting. So some people, what they do, they'll talk all about vestibular neuritis, that it's self-limiting condition, it will resolve on its own, it's usually caused by the virus and blah blah all story. But they'll just forget the very basic, that you have to give antiemetics. Okay, as a junior doctor, you can do the symptomatic treatment. So this is very important, that you never miss the symptomatic treatment. Maybe a patient comes with back pain, and you find out in the history that he is having some problem with the prostate. In the end, you are talking everything about the prostate, that will give you finasteride and tamsulosin, it will just relax your bladder, and all that. But the first thing he complained, I'm also having the back pain, so you did not offer the painkillers. So that will be a big mistake. Okay, very important to give the symptomatic treatment. It's just that if someone is in pain, give painkillers, nausea, vomiting, give some antiemetics, and then the specific treatment. Then you can talk about it. Ask if the patient wants to know about it. So how we are going to manage it further. For example, in the same BPH for the prostate problem, there are medications we can give to relax the neck of the bladder or to shrink the prostate. So that you can talk about. And the sixth is the safety netting. It is really, really important. I can't stress this enough. Uh, if you are not doing the safety netting, you won't be a safe doctor. And that's the basic number one criteria. Okay. If you want to enter the system, the first thing they are going to see is that either you are safe or not. So there are two things in the safety. The first, do you rule out the red flags in your history? Okay. And the second one is, are you doing the safety netting or not in the end? And then the seventh, the last one is the follow up and leaflets. So follow up is according to NICE guidelines. You can find it. There is a specific follow up of every scenario, but it's not necessary that you remember each of them. But just say the patient that we are going to follow you up, and uh, whatever I've told you, a lot of things, it could be a little bit overwhelming for you. So what about if I give you some leaflets, or I can give you some reading material, or I can print out some material for you, which will be having a lot of information about this condition. So you go and have a read and let me know if you have any other questions. So the leaflets, it's very important to ask. Okay, safety netting would be the red flag symptoms. For example, a person comes with TIA, okay, transient ischemic attack. So what would be the safety netting? Safety netting would be fast, okay. The fast is the mnemonic for stroke, okay. Any facial weakness, any arm weakness, okay, any slurred speech, that it's time to come to hospital, time to ring 999. So these 7 steps, it's very important. Your management will be good, your IPS will be good. If you are taking your management in a very patient centered way, answering all the questions and taking care of all the points in your communication skills, then you'll be good to go. Even if you get 3 in management and IPS and 2 in history, so it's an 8, that's a sure pass. Okay, now the seventh point is the repo. The repo is, you have to show sensitivity for the patient's feelings. And are you sounding patient centered or not? Are you involving the patient? There's a check and chunk technique, like you say a few things and you check if they are getting you or not. Like, does that all make sense? Am I making sense to you, Mr. X? Are you following me? Okay, so just make sure that they are with you, you both are on the same page. It's very, very important. And just showing some sympathy, and just making the patient comfortable. Okay, and it's actually it actually comes in your IPS domain, and I'll make a separate video about it. Basically, the repo is actually how you engage the patient, how you involve the patient, and are you being sympathetic or not? Are you being sensitive for the patient's feelings or not? Okay, this comes under the repo. And if you are just going blank faced and just saying, not checking the patient's understanding, and just saying everything that you have learned and or memorized, you'll be marked down in this. Okay. Now, number 8 is the listening. Okay, it's very important that you actively listen to the patient. So they would be verbal and non-verbal cues as well. Okay, the patient might say, in between, the doctor, I feel so drowsy. Okay, so you have to check box that in your mind, that the patient has raised a concern and you have to address there. Okay, maybe the patient is taking some medication that might be causing drowsiness. For example, a patient who is taking simvastatin, okay, that patient could have the side effect of the medication and he's feeling drowsy, so you need to pick that. So you have to say there in your management that, Mr. X, you mentioned that you are feeling so drowsy that these days, and I can see that you are taking simvastatin as well, so it's one of the side effects of this medication. How about if we talk and discuss this in detail, maybe change your medication or dosage. So these are the things. This is a verbal cue. Okay, so you need to pick. The patient has raised a concern, you should listen to that and you should talk about it in the management. Now there could be non-verbal cues that also come in the same domain, like a person who is not maintaining eye contact with you, is just fidgeting his hands and just looking irritable. So you have to pick up that cue that, Mrs. X, I can see that you are a little bit uncomfortable. Is there something bothering you? Okay, I can see that you look a little bit uh, down. Is everything all right? So you have to pick both verbal and non-verbal cues. It's very important. It's very important that you listen with your full attention and with patience. What I've noticed in the mocks and so far in my experience, the mistake the people do is that they look so eager in talking everything that they have learned, because in the cubicle the script will be running through their mind and they will be, oh my god, I have to talk about all this. So they will not listen to the patient attentively. Okay, they do ignore the patient sometimes, and they are just so ready to tell everything, and in doing so they ignore the patient, and then you'll be marked on the listening. Okay, so be very calm and patiently listen to the patient. When the patient is it has finished, then start talking. Okay, so it's very important that you listen attentively. Next is the language. Okay, so this is very important. It should be simple, clear, and understandable. Okay, speak in a very simple way that the patient understands, and avoid medical jargon. If you are speaking a lot of medical jargon, okay, then you could be marked down on language. So the aim of this specific criteria is that the patient must understand. The patient must understand what you are saying. For example, when you're, I've also noticed this in the mocks, that when you're doing examinations, you'll say that, okay, Mr. X, is it okay if I examine you? I'll be checking your observations, your blood pressure, your pulse, your respiratory rate. So do not say respiratory rate. It's a medical jargon. You just make it simple. I'll be checking your breathing rate. So do not say respiratory rate or any other medical jargon. It's just one example. So it's just that, make your language simple, nothing else. And the last thing, this is the most important, okay? Time management. Now this comes with the practice. Practice it on a 7 minutes bell. I would advise everyone to practice on a 7 minutes bell. If you don't have the 7 minutes bell, let me know on the Telegram. I'll send it on the Telegram. And normally, roughly, you should keep your history and examination to 3 minutes, and your management should go for 4 minutes. Okay, and this is something, guys, you'll have with practice. Okay, time management is something you can master when you practice. And the main issue people are not able to manage the time is because they take a very long history. So you need to learn how to cut back on the history, and you have to resist the temptation to ask every question and ruling out every differential. You can't rule out every differential, you just have 8 minutes. Just rule out the red flags, okay, the very alarming symptoms that can lead to death, okay, for example cancer, the cancer symptoms you cannot miss. So you just rule out the red flags and move on. Okay, resist this temptation. It happened with me also. It happens with everyone, but with time you learn to adapt. For example, there is a station, a palliative station. Okay, the patient is dying, so in that station, will you ask about the smoking? Will you ask about the alcohol? Will you ask about is she exercising or not? No, that does not make sense. Even though it's in your approach that you need to ask social history, but see what's the case. The patient is on palliative, she's dying. So you do not waste your time asking about all those irrelevant questions that might not help you. Yeah, so it's Dr. Bilal, you'll master with practice. When you practice, you'll get to know with time that what's important in a particular station, what you can skip in a particular station. So you learn that with practice. Okay, so that's the time management, and it's very important that especially in the combined station where you have to take history, you have to examine on a mannequin, and you need to do the management. There are a lot of things and you have just 8 minutes. So in that scenario, your history should be very focused. Okay, so lastly, how you can improve. So guys, practice as much as you can. Practice with each other. Practice mocks. Okay, when I was preparing, I used to do mutual mocks. I used to gather people from my group, and 6 stations. I'm doing 6 stations, and they are giving me 6 stations. So you can do mutual mocks as well, and you can take mocks if you have some colleagues or your friends who have recently given the exam. Ask them to do some mocks with you if they have time. Okay, and apart from that, there are many platforms who are offering mocks, and you can try that as well. And you can even take mocks with us on daily stations. And I have recently started taking mocks, and they've given a very good feedback, and I'm marking them. I've made a template, and I'm marking them on both quantitative and qualitative areas. Okay, so you can try that as well if you wish. And if you don't find partners and you don't want to book with any platform, and you can just practice in front of a mirror. I also used to do this sometimes if there's no one to practice. uh, I just used to sit in front of a mirror and I used to practice with myself. So that can also help, but the key thing is that you need to practice in any of the ways, but you need to practice and practice as much as you can. And apart from that, try to have try to practice with those people who give you a good feedback. Okay, who are able to tell you that where you are lacking, so when you work on the areas where you need to work, so that will really help you. Okay, so if you want to contact us, you can contact us on Telegram or WhatsApp. You can contact on this number which is given here, and you can even send an email to us on dailystations.plab@gmail.com.